So patients that are eligible for a breast lift, or the patient population that typically comes in for a breast lift, has experienced changes with age, but oftentimes with breastfeeding, sometimes with weight loss, and the tissues of their breasts are not high on their chest anymore, and they've fallen down below the crease under the breast. The goal of the breast lift is to move the entire breast back up to the position on the chest where it belongs, up above the crease under the breast. And those patients who've experienced the sagging of the breast are the ones who are candidates for the surgery. A breast lift involves removing the extra skin. After the breast has descended, or soft tissues come down, or the breast is sagged, the only way to really treat that is to take away some of the extra skin to allow the nipple and areola to come up to the central part of the breast mound again. For breast lift, I see patients in consultation. We talk about whether or not an implant is an essential component to their treatment plan, or if a breast lift alone will accomplish what they desire. I spend a great deal of time taking measurements. That helps to identify asymmetries. We talk about those asymmetries, and we come up with a plan of what the scar pattern might be. We talk about whether an implant might be important. Patients often ask about the scars associated with the breast lift. That's the main detractor from a breast lift. But what I tell patients is that those scars are a worthwhile trade-off to achieve the contours that we're looking for. And oftentimes patients are apprehensive about these scars. We talk about the pictures on the website being taken at 3 months, which is a time when the scars are still at their peak pigmentation, meaning they're the darkest or the pinkest that they'll be. And I explain to patients that over the course of a year, the collagen in scars changes, and that those scars lighten tremendously. If a breast implant is part of the surgery, breast implant is placed first, and the lift is done around that, so that I can see the additional volume and then tailor the lift accordingly. If there's no breast implant used, we go directly to the breast lift. My typical incision is either a lollipop incision or an anchor incision, whatever is needed in order to remove the necessary skin to give the appropriate lift. I talk to patients about what they want from their breast lift. Breast lift is indicated whenever the breasts have sagged and we need to get them back up on the chest. Talk to patients about their desire for upper pole fullness, cleavage, size, those sorts of things. If they're very important to a patient, then we add an implant. Some patients want to downsize, and a lift lends itself towards taking away some extra breast tissue, much like a reduction. We're able to downsize the breast. So most important to understand what it is my patients look for. Oftentimes we look at wish pictures together, we look at pictures from the website, so that we can define their goals and then tailor the surgery to match those goals. The recovery time for a breast lift is pretty quick. Patients with a breast lift alone feel pretty good within a week. If we do an implant, there's a little bit more stretching of the muscle. It prolongs the recovery just a little bit, but patients are back to work within a week. They're back to the gym within 3 weeks and feeling 100% by 3 weeks to 4 weeks.